Hello and welcome to the urgent care clinic. My name is Dr. Clayby, and I'm going to be examining you today. What happened to you? Okay, well, I'm gonna stop you right there. Let's get some info down, and then we can take a look at what's going on here. Do you mind just telling me your name? Conrad Stevenson. Okay, and your date of birth? Okay, and is that your preferred name, and how do you like to be addressed? Okay, very good. So, I would ask you what I'm seeing you here for, but I can see pretty clearly you've got a couple injuries here. So, would you mind telling me a little bit about what happened? Run that by me again. A demon. Okay. So you were on a job and you were attacked by a demon. Okay. We can get into that a little later. So besides the injuries on your head, and I'm noticing here there's a couple lacerations on your arms. Is there anything else that I'm not seeing immediately? Just some scrapes on your hands. Okay, and a bit on your knees. I see. Yeah, you ripped the pant there, huh? Okay. So let's see. Okay. Any fever, chills, or sweating at all? Out of the ordinary? I know it seems like you've, pardon me saying, crawled out of hell, but anything that doesn't coincide with that? No. Okay, good. If that changes, let me know, all right? I want to make sure that you won't be running the risk of infection. Okay. Any other illnesses at this time? Any mental illnesses or neurological? No. Okay. Not even a head cold? No. Me personally, I'm suffering from seasonal allergies, hay fever. Not contagious, but kind of a pain. Are you on any medications by chance? Okay. And any allergies? Maybe mold or dust, anything like that? No? Okay. All right, so since you are quite alert and oriented here, I just want to run through a little concussion checklist right now as opposed to after we get you cleaned up, okay? Just so that as soon as we get you cleaned up, should you be running that risk, we can move you into observation. So, you have any dizziness at all? No? And any headache? Just a little bit. On a scale from 1 to 10, with 10 being the worst pain you've ever experienced and 0 being no pain at all, how bad is that headache? Maybe a 2, right? And any trouble concentrating at all? No? And any memory issues? No? Okay. I'm going to take a quick look in your eyes, okay? I'm just going to use my pen light here. And I'm just going to come in real close, okay? I just want to look into your eyes. So what is it that you do exactly? What kind of line of work? Oh, I see. Paranormal investigator. Well, that would coincide with you saying you were injured on the job. Okay. What exactly were you investigating before this happened? Okay. Haunted house? Yeah. Keeping the family up, and children had been reporting some oddities. Ended up to be in the basement. Interesting. Well, I think I'll have you tell me a little bit more about that. I must say my interest is piqued. It's not often that we run across paranormal investigators. So I didn't see any abnormalities in your eyes at all. So we're going to move on to looking at your wounds. So as far as the scrapes on your hands, there's not a lot I can do there. We can clean them up, but otherwise there's not much that can be done there. We could bandage your hands, but I imagine it might be a little overkill. But if that's the way you want to go, that's fine. And as far as your arms, I don't see anything that looks like it needs to have any stitches. That's good. I think we can get away with just cleaning them up. Your head's a little bit of a different story. I want to take a closer look at that. I haven't seen you actively bleeding since we've been here. Everything looks to be clotted, but I want to have a closer look. I'm going to pop on some gloves, and from this point forward, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? It's a bit humid in here, isn't it? I know. It's been great for allergies when it's been raining, but then when it stops, it gets very muggy very quick. So, let's see. Just want to have my tools at the ready. I'm going to take a look at you first, and then we'll clean you up. So I've got a magnifying glass here. I'm going to get a little close, but I want to see if these wounds need to be debrided, and if so, we'll get right on that. So, I assume the arm and hand injuries, those are from you running out of the house, right? Okay. And what exactly happened with your head, if you don't mind me asking? I'm asking less as a medical professional and more as a person interested. So it wasn't the demon itself, but you had knocked yourself into a wall? Okay, yeah, that explains the shape. But then, what about over here? What was happening here? Okay, not sure on that one. Okay. It was all pretty dark, so could have hit anything. I see. Okay. There might be a little bit right here. Just going to move the hair out of the way here. Well, I don't think we will need to get any dirt or any foreign particles out of the wounds. So we're going to do some old-fashioned cleaning, okay? Now I have to warn you that this will be, it'll be cold and it'll probably sting, okay? Now, luckily, your wounds don't seem to be too deep, so we won't have to do anything further than just cleaning them out and bandaging them. But when I get them all cleaned up, I'm going to take another look just to make sure. We don't like to mess with head wounds. Alright, let's see. I apologize. It's never fun, but we gotta make sure this is all cleaned up. You weren't exactly sure what you hit, so we don't know if there's anything that we should be concerned about in the wound. So the demon didn't attack you, but it did scare you, obviously. Did you get a photo by any chance? You did? Huh. A couple. Interesting. There's a flaming orb? Really? That's strange. Don't know that I've ever heard of such a thing. And then, what did the demon look like? Oh, yeah. So, is it all gone now, or did you just leave the house and that poor family to fend for themselves? Okay, so you refer them to someone who exorcises them? Okay. That's good. That's good. I was concerned that you had just gone in there and said, "Yep, that's a demon," and left. I think a lot of investigators do that. But I'm glad that you're getting them the help that they need. So what does an investigation look like for you? What kind of tools do you use? Like, I have my stethoscope and my sphygmomanometer, my imaging and whatnot to determine what's going on with someone? How do you determine a haunting is going on and what to do about it? So you have a thermometer, okay? Fluctuating temperatures tend to indicate paranormal activity. Interesting. I see. So, known as cold spots. Okay. And what else? Electrical activity. Really? Electromagnetic activity. I see. So you have an EMF reader and a thermometer and an EVP. Okay. What's an EVP? Electronic voice phenomena. Okay. So you just ask questions and see if a ghost answers? Pretty much. Does that happen often? No. Then what do you usually capture? Footsteps. Crying? Oh, that's a little unsettling. So what would you say is the most common haunting you get? I imagine there's different types, right? Usually it's more residual. I've gotten a lot of intelligent lately. So where does the demon fit in all this? You mentioned the residual and intelligent. Just gonna clean up your arms here. The demon was kind of a one-off, huh? Not very common, but very scary. Are there any other types of ghosts you get? Poltergeists. What are those like? Really? So they throw things and you hear things get broken, but then when you look, there's nothing there and everything's just put back together. That's strange. Right. If you wouldn't mind just flipping over your hands for me. Yeah, scrapes always sting the worst. The alcohol. Your nerves are right on the surface. So that's why a paper cut often feels much worse than a deeper laceration. Because it's so close to those nerves where they pick up information. Other hand. Almost done. So, residual, intelligent, poltergeist, and demon hauntings. That's quite a handful. So you do this all yourself? You have your own practice and everything? Huh. Well, I think I am lucky enough to not need your services, but I'll have to keep you in mind should I know anybody that does. We're going to finish up your other arm here. So, I have to ask, are you planning to go right back out in the field, Or are you going to take a couple of days off? Yeah, I bet there's quite a few cases waiting for you. That is too bad that you won't be able to take much time off. Okay. So with the scrapes, I don't think we'll need to put any antibiotic cream on them. And they should heal up within a couple of days. I am going to get the ones on your arms, so they're a little deeper. And I'm definitely going to get the ones on your head, okay? So I'm going to get a little cotton bud and a little bit of the cream here. Okay, just a bit. And let's go ahead and get into that cut there. Okay. So do you know anything about what the family's gonna do now with that demon? Okay, so you'll hear back from whoever does the exorcism and you do a follow-up investigation. It's good to know. Apologize if this hurts a bit. I just want to make sure that I'm dabbing that into the wound. Let's get up on your head here. Okay, just hold still for me. I think overall, I didn't even need the magnifying glass. It's just a surface cut. Okay. There we go. Let's get into here. So I've got some bandages that I can put on you. And then I think just to make sure there's no concussion, I want to do a quick little neurological examination, if you don't mind. Okay. So we're going to go ahead and just couple on your arms here. Okay. One more. I think that'll do it. So, just going to take a couple of notes. Okay, so I'm going to ask you a few different questions, okay? And just want you to answer them the best that you can. What approximate time is it? Or at least, what time is your appointment at? Okay. And what day of the week is it? What month? And what year are we in? Good. Where are we right now? And do you remember my name? Dr. Clay. Good. Okay. What is the capital of our country? Good. And just want to have you look at my hands here. I'm going to hold up some numbers. I want you to tell me what number I'm holding up. I'm just going to get resituated real quick. Don't have to be so close to you now. Okay? So you can look at the numbers, you can look at my nose, it doesn't matter. Just want you to tell me what number I'm holding up. Okay? 5, 3, 2, 4, 10, 1, 6, 6. I'm just playing with you. Okay. 1, 2, 5, 4, 9, 7, 2, 3, 5, 10. Okay. Very good. Okay. So I'm going to hold up a few objects and I want you to tell me the names of them. Okay? Pen. What's coming out of this? A light. Okay. This. Magnifying glass. Cotton bud. glasses. Hands. Okay, very good. Now I'm going to have you look at my finger here. Okay, I want you to touch your nose with your finger and then touch my finger. Okay, so it would go like this. Okay, can you do that for me? Right, so touch your nose with your finger and then touch my finger. Nose, finger, nose, finger. Okay, and I want you to go back to your nose, and I'm going to be moving my finger around. I want you to keep trying to touch my finger. Okay, so finger, nose, finger, nose, finger, nose, finger, nose, finger, nose, finger, nose, back and forth. Okay, very good. So your coordination looks good, your recall's good, memory, general knowledge is good. Just want to double check with you real quick that concussion checklist since we've been here for a bit. You have any dizziness at all? Okay. And any headache? It's gone down, right? Any trouble concentrating? No. And memory issues? No, I didn't think so. And you've been articulate the entire time, so I don't see any issues with your speech. Let me just do one last check of your eyes, okay? I'm just going to shine this light into your eyes. Just keep looking ahead for me. I know it's bright. Apologize if it makes your head hurt. Just want to check for any defects, any abnormalities. Okay. Okay. I must say, I am pleased with how that's all worked. So, I don't believe you have a concussion, but I want you to keep an eye on if you get a sudden onset headache, or if you experience any dizziness, trouble concentrating, or if you feel extremely sleepy, okay? Should any of those things happen, I want you to either go to an emergency room or you can give us a call if there's someone with you so that we can evaluate whether you need to be seen, okay? But we don't want you to fall asleep, all right? So I think for the next, let's do the next 12 hours, we're going to wait on sleeping. Just to make sure, since you haven't had any symptoms so far, that we're out of the clear, okay? So, as far as your injuries, I want you to take note if you experience any fever, chills, or sweating, and I want you to give us a call if that happens. That might be the sign of an infection. I also want you to keep an eye on your wounds. I'd like you to, let's go ahead and change the bandages once a day. You don't have to put any more antibiotic cream on them if you don't want, but I want you to clean the wounds and redress them, okay? If they become more inflamed or hot or just don't feel right, go ahead and give us a call, okay? Now, for general pain, we can do acetaminophen, okay? So I'd like to stick with that. I think we're going to stay away from NSAIDs, aspirin, that sort of thing. So we'll do acetaminophen. Okay. And other than that, rest, drink lots of fluids, take it easy with the demons out there. Okay? Any other questions? Any concerns? Okay. So I'm going to go ahead and sign you off then. Okay. And I think that we're all done here, okay? So I hope that that poor family gets that demon out, and I guess if I have any ghosts, I know who to call. Is that what your business is under, your name? Conrad Stevenson, paranormal PI. Okay. CSPPI. I'll keep that in mind. Okay? Well, thanks for coming in, and I hope those wounds heal quickly for you and you don't get any demons anytime soon. All right? So I hope you have a whale of a day and a good rest of your night.